The bill arrives on a Tuesday. It says $9,000. You read it once, then read it again. You had insurance. You showed the card at the front desk. The ER was in your network. You checked before you left the house. You were there for 4 hours. You went home healthy. And now a piece of paper on your kitchen table is telling you that you owe $9,000. Your first instinct is that someone made a mistake. Nobody made a mistake. This is the system doing exactly what it was designed to do. And what you're holding right now is not just a bill. It's the invoice for a negotiation nobody told you was happening. This happens to roughly 1 in 5 Americans who visit an in-network emergency room every single year. Here's the first thing your insurance card doesn't tell you. It resets. Every January 1st, your deductible, the amount you pay completely out of your own pocket before your insurance covers anything, goes back to zero. According to the Kaiser Family Foundation, the average deductible for a single person on an employer health plan in 2024 was $1,187. For a family plan, it was over $3,000. That means the worst financial time to get sick in America is January, and the second worst is February, and the third worst is March. Because the entire first quarter of every year, you are paying the full negotiated cost of every medical service before your insurer covers a single dollar. Your insurance didn't fail you. It was never designed to catch you before the deductible. It was designed to catch you after it. That's not a gap in the system. That is the system. By the end of this video, you will understand the 3 mechanisms that turned a 4-hour ER visit into a $9,000 bill. You will know the federal law that already protects you from part of it, and that most people pay before they know it exists. You will know how to request the one document that exposes billing errors most patients never catch. And you will know the 4 steps that brought one woman's $9,000 bill down to $1,200. Not through luck, but through knowing what to ask. Let's talk about what that bill is actually made of, because yours probably didn't come from one place. It came from 2, maybe 3. The first statement is from the hospital itself. The second is from a physician group, a separate company, whose doctors treated you inside that hospital. You went to one building. You showed one card. You assumed one bill. Here is what the emergency room does not explain when you check in. The hospital and the doctors who work inside it are often 2 entirely different businesses with 2 entirely different insurance contracts. The building can be in your network. The physicians standing inside that building may not be. This is called surprise billing. And according to the Consumer Financial Protection Bureau, roughly 1 in 5 ER visits in the United States results in at least one out-of-network charge, even when the patient specifically chose an in-network facility. This happened to a school administrator in Columbus, Ohio. We'll call her Jamie. Her bill said $9,000. She showed her card. She checked the network. She did everything right. The physician who treated her was not contracted with her insurer. That bill was processed at out-of-network rates. She found out 3 weeks later by mail. What happened to Jamie is not unusual. It is the default. But the out-of-network physician charge is only the first layer. The larger number, the hospital's portion, comes from something most patients have never heard of. It's called the chargemaster. Every hospital in the United States maintains a master price list, a document that assigns a dollar amount to every service, supply, and procedure they provide. A bag of saline solution, listed at $500 at many facilities. A standard ECG, the test that reads your heart's electrical activity, billed at $800. One tablet of acetaminophen, that's the generic name for Tylenol, charged at up to $30 per pill. These numbers are not what anyone with information actually pays. They are the opening position in a negotiation. Think of it like the sticker price on a car lot. It is the number on the window, not the number that changes hands when someone who knows what they're doing sits down at the desk. The card in your wallet doesn't pay your hospital bill, and the hospital's first number is never the number they expect you to pay. When your insurer processes your claim, their pre-negotiated rate with the hospital reduces the chargemaster price, sometimes by 30%, sometimes by 60%. That reduction sounds significant, but if you haven't met your deductible yet, that reduced number still comes directly out of your pocket first, every dollar of it. Then your co-insurance, your percentage share of costs after the deductible, typically 20%, applies to whatever's left. By the time you've paid the deductible, the co-insurance, and the out-of-network physician bill, you are holding a number that was built from 3 separate mechanisms running simultaneously, and none of them were explained to you at the front desk. That's not an oversight. There's no legal requirement to explain them. So now you know how the bill becomes $9,000, a deductible that reset in January, an out-of-network physician inside an in-network hospital, a chargemaster price that nobody told you wasn't the final number. But here's what most people who receive this bill never reach. Every one of those numbers can be challenged. and you have more tools than anyone told you exist. In January 2022, the federal No Surprises Act took effect. A law passed specifically to protect patients from out-of-network charges in situations where you had no real ability to choose who treated you. Emergency care is explicitly covered. If you go to an in-network emergency room and an out-of-network provider treats you, the law caps your cost at your in-network rate. You cannot legally be billed above that threshold for emergency services. Most people pay the full out-of-network bill before they ever learn this law exists. Jamie did. She overpaid by over $1,000 on a charge the federal government had already decided she didn't owe. That's not her fault. That's a system that does not volunteer information that costs it money. But the second tool goes even deeper, and almost nobody reaches it. Every nonprofit hospital in the United States, and according to the American Hospital Association, 58% of all U.S. community hospitals are nonprofit, is required by federal law to maintain a financial assistance program. You may have heard it called charity care. These programs can reduce your bill significantly or eliminate it entirely based on your household income. The income thresholds are higher than most people expect. A family of 4 earning $60,000 a year qualifies for meaningful reductions at many major hospital systems across the country. The hospital is not required to tell you this program exists. They are only required to have it. The bill arrives with no mention of it. The online payment portal opens with no mention of it. The automated collections call mentions none of it. The number they sent you was not the number they expect every patient to pay. It is the number they send to patients who don't ask what else is available. And right now, the Consumer Financial Protection Bureau estimates Americans are carrying over $88 billion in medical debt. Most of it held by people who had insurance. Most of it built from bills that were never final. Here is what Jamie eventually learned. 8 months after that Tuesday evening, and after a lot of it was already paid. And here is what you can do before you pay a single dollar. First, not the summary statement they send automatically. The line-by-line breakdown, with every billing code listed. Studies reviewed by the Medical Billing Advocates of America indicate the majority of hospital bills contain at least one error. Jamie's contained 6, including a charge for a procedure she had declined. Second, the process is handled through your insurer. It costs you nothing to file. It resolved in Jamie's favor within 30 days. Third, call the billing department directly and ask for the financial counselor, not the billing agent. Ask specifically, do you have a charity care or financial assistance program, and can you send me the application? That question alone changes the conversation. Fourth, many work on contingency, a percentage of what they save you, no upfront cost. Between the itemized bill corrections, the No Surprises Act dispute, and the financial assistance application, Jamie's $9,000 became $200. The tools were available the entire time. Nobody sent a letter explaining they existed. Your insurance card doesn't protect you from the bill. It changes the size of the bill. Those are not the same thing. And the gap between what a hospital asks for and what you are actually obligated to pay is a space that most Americans never enter. Not because it doesn't exist, but because entering it requires knowing it's there. You know it's there now. That changes what you owe. If you have a medical bill sitting somewhere in your house that you haven't opened yet, open it, then request the itemized version. Those are 2 different documents, and the second one is the one that matters. If any part of what you learned in this video applies to a bill you've already paid, it may not be too late. The CMS Patient Advocate Guide and the No Surprises Help Desk are free. And the No Surprises Help Desk is open 7 days a week. The links are in the description below. Centers for Medicare and Medicaid Services. If you know someone sitting on a medical bill they don't understand, send them this video, not as a suggestion, as a resource. It might save them thousands of dollars. That is not an exaggeration. Drop in the comments. Have you ever received a medical bill that didn't make sense? How much was it? Did you pay it in full? The comments on this channel are the most useful part of it, because your story is the next person's warning. And if this is the first body of debt video you've watched, next week we're covering something that affects every American who has chosen a health insurance plan during open enrollment and assumed they picked the right one. Most didn't. Subscribe so you're there when that video goes up.